Right.
Because you have to be over 65.
All right, so when you say we're not getting, who's we?
So the health department, there are two pots, to my knowledge, there are two pots of vaccine. Some comes to the health department,
Right?
Hi, Diana.
some comes to the hospital.
Right?
The hospital goes.
Hi, Diana.
The health department goes send out TCCA.
Hello? Hello? I just wanted to make sure when I'm on, I'm muting.
The governor's.
Sorry, it's kind of hard to hear you.
You just come in and mess everything up, like just.
It's so good to see you though. I know, I haven't seen you in person, well, I've been in person for a while.
Hello? Hello?
They are all muted. Who am I talking to? This is Diana Grossi.
Hi, can
This
you
is
hear
Barb.
me?
Do that again next year. Which is wonderful.
Can no one hear
In
me?
the comments.
I got your seat tonight.
I see you did.
Yeah.
And you're gonna make me have to turn around with my arthritic neck and my back and my legs.
I didn't decide you. Okay. Oh, yeah. You wanna switch?
Can no one hear me?
Oh, I can hear you. Where's my
Well, we
mask?
can hear.
I can hear you, Kate.
Okay, good.
I forgot it.
Hi, Karen. Robbie Robinson.
Hi, nice to see you.
Robbie, did you get rid of all of your 15 more vaccines that you gotta do? That was dangerous to put that in.
That was really fun.
That was.
That was really tough.
I'm sitting there going, he's not really saying that, is he? Because you're.
I'm not hearing anything.
I have it muted.
If you can believe that.
Yeah, it's not 4 o'clock, yeah.
Okay, that's,
I can't believe it either.
Oh, of course.
By the way,
That's called silence.
I would like to introduce the new chair of the V&A.
Yes.
Oh, wow.
There he is.
The new chair.
You couldn't wait to say that, could you? The new chair. Just today, right?
Yeah.
Or
Just
yesterday?
today, a couple hours ago.
I couldn't remember if it was today or yesterday.
No, I just want to see.
Well, congratulations.
Yeah.
Oh.
A V&A treasure post.
Oh, wonderful.
The big
are.
board.
Trained ya.
Remember?
Good trade, huh?
That's a good That was worth coming. Can I come again tomorrow?
Yes, but you don't get the same prize tomorrow.
Okay.
There's a big.
I might have to leave if I get a very emergency phone call about my husband's medical license.
Okay.
And then I'm going in your office because I'm loud as anything and I'm very angry.
Uh-oh.
Yeah.
Well, God forbid, we do not want that, Anne Marie.
So I'm going to, if I get a vibrate.
Thank you, Jay.
This is the one.
I have that one stuck on my desk. Throw this one.
Well, yeah.
Is that great?
Diana.
Diana.
Yeah, yep.
very quiet.
So Barbara's not
Enjoy.
coming?
It was super loud just a minute ago. Michael and Barb will be on the phone. Hello? Did you throw it out?
No, I'm not.
Oh, okay. Like I gave it to you.
You have another one of those dresses.
She has a lot of dresses.
I thought the other one was red and black.
A lot.
That's what I'm saying,
But
but this one is sweater and it's really hot.
I have.
No, today I'm really hot.
Times a meeting.
Yesterday I was
But I
not
used to
really
not.
hot.
You know, it's like your,
Well,
so wasn't as hot outside yesterday.
But you can, I guess I didn't realize that I was.
Saving travel time, you can.
In the level.
By the time you get out of here, it'll be cool.
A lot more time.
I was waiting for that, actually waiting for that to happen. I haven't been outside all day, so.
Oh, it's beautiful.
Mhm.
I know, I dressed this morning, that's the sauna and walked out.
She's not, she's already showed me.
Yeah, I just, a lot going on. There's a lot going on. Did anybody, I know Bill was on the meeting this morning. Anybody listen in on Pat Nipper's meeting this morning?
Yes, I listened to the whole thing.
I did, yeah, it was very good.
It was a good meeting.
It was a good meeting.
Yep.
Then what are you upset about? There must be something.
She said, I only said that because she said she's waiting for this call, and she's really
My
mad. so she's
husband
gonna
is
yell at
trying
me.
to continue his medical license. He's done all of the CMEs. He sent them all that to the place. And I have receipt that they got it. And they haven't, they said they didn't get it, but I have a receipt that they got it. And I've been on the phone. So when you call a number,
Right.
Mhm.
you have to go on the list of callbacks. And I'm angry with myself. I left my phone when I went to the bathroom. They called me back and now I have to go on the wait list again.
Out of the bathroom with you.
Oh,
Yes,
well,
I'm angry with myself.
I see, yeah, well,
Now you're back on the call list.
Okay,
So
it
who
is
is-
4:00. We are gonna go ahead and get started. Welcome to all of those on the phone and on Zoom. This is the January meeting of the Indian River County Hospital District, our regular monthly meeting, first one of 2021. So, the first meeting of every year, we start out as an organizational meeting, and I will turn this over to Jennifer Peschke.
Okay, well, as you are all aware, bylaws of the Indian River County Hospital District require the district to be organized at the first meeting of each year, and we elect 5 officers. Any member may make a nomination for any of the 5 offices. Put on each vice chairman, secretary.
Yeah, that's a problem.
It's done. No.
Oh, the outside.
Barb, can you please go on mute?
For a minute, can you mute her?
But I'm afraid it won't unmute.
Okay.
Thank you.
Okay, let's try
oh,
again.
this is fun.
Okay, so our bylaws require us to reorganize at the beginning of each year and elect 5 officers. And so the 5 offices are the chairman, the vice chairman, the secretary, assistant secretary, and treasurer. Each office will be elected by calling for nominations, a second nomination, and a motion to close the nominations. So we'll start with chairman and we'll go down the list from there. So do I have a nomination for a chairman, please?
It'd be my honor to nominate Mary Beth Cunningham to continue doing the splendid job she's been doing.
I second.
Second that.
Okay, any other discussion? Otherwise, we'll make a motion to close the nominations, and Mary Beth Cunningham has been nominated for chairman of the board for this coming year. All in favor?
Aye.
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 Any opposition? Hearing none, Mary Beth will be our chairwoman again
Congratulations,
this year.
Mary Beth.
Thank you.
And
Congratulations.
Okay.
Thank you, Michael.
we'll call for a nomination for our vice chairman of the board.
I'll nominate Michael Weiss to continue as vice chairman.
Second,
Okay, any discussion? If not, we'll request a motion to close the nominations and proceed with all in favor of Michael Weiss for our vice chair.
I,
Aye.
Aye.
Okay, hearing all ayes, any opposition? Hearing none, we'll move forward with Michael Weiss as our vice chair. Next will be needed for our secretary.
I nominate Anne Marie McChrystal for secretary.
Second.
third,
All right, I'll make a motion to close the nomination. All in favor of Anne Marie McChrystal serving as our secretary.
I,
Aye.
Any opposition? I don't know if I heard. All right, Anne Marie will be our secretary.
right.
Next is the nomination for vice secretary, assistant secretary.
I'll nominate Barbara Bodnar.
Second,
Any additional nominations? Otherwise, I'll make a motion to close the nomination. All in favor of Barbara Bodnar for assistant secretary?
I,
Aye.
Thanks, Sam.
And last, I need not last but not least at all, this is a very important position, we need a nomination for our treasurer.
it is my pleasure, my distinct pleasure, to nominate Alan Jones as treasurer.
Second,
third, fourth, fifth.
Yes.
Okay, I'll make a motion to close the nominations. All in favor of Alan Jones serving as our treasurer?
Aye.
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 Hearing no opposition, Alan will be our continuing treasurer. That concludes
Yay,
our
Alan.
election for 2021.
Yay.
Stay safe, stay well.
Okay, the other
Everybody
consideration
stay well.
that we do have, obviously, we have been meeting on the third Thursday of the month at 4 o'clock for our regular meeting and the Wednesday before at 10 o'clock. Is there any change that anybody would like to propose to that, or should we go forward with that?
I think we should go forward with that, but are we going to be going back to eventually to the administration building, or are we here?
That's your next.
That's the next,
Oh, I'm sorry.
after frequency and time, that is the next item.
Oh, okay,
Is
I'm
where-
sorry.
That's okay.
This
Is
is
everybody
fine.
good with the
Yeah.
the times and dates we've got?
Worked out.
Okay, we will keep that. Then, for the regular meetings, would you like to go back to the county chambers, or do you want to stay here? What is your feelings?
My preference is to go back, just at least as long as COVID is a thing, because I think it's safer.
Okay.
I think, I certainly safe over there, but also, isn't that televised?
Yes, that's.
And I think it's important, once that started up, I thought, years ago, but people like to watch it.
You'd be amazed at how many people watch
I
it.
know, and I think it's an important thing for the community.
Yeah.
So I would like to go back there, it's certainly safe.
Does everybody agree with that? Barbara, Michael?
Yeah.
Does it cost?
Yes.
anything? What does it?
I'm okay with it, either way.
You know what, it's worth it.
Oh, I understand.
Yeah,
I just
it's a
wanna
very
know,
small
that's all.
cost.
It's a
The
minimum.
cost is for the recording,
Yeah.
and that's $650 a quarter.
I think it's important for the community,
I agree with
otherwise,
Anne Marie.
Yeah, the room does
Well, I
it.
also think there's a little more formality to it that
Absolutely.
adds something.
I
And
agree
space
with
if you
that.
guys
I
have a
agree with
lot of
everything's been
people.
said.
Yeah,
All right,
Okay.
that's,
I will contact them and let them know we're gonna continue.
okay, all right.
I'm glad you.
Good. No, I think
O'clock, we
that's,
said?
that's the right thing, at 4 o'clock, right?
Yep.
We're still
And
good.
10
Yeah,
o'clock
will that start next month?
Okay,
Yes.
all right, moving on, we'll go to the consent agenda. So can I have a motion for the approval of the regular monthly meeting minutes dated December 17th and the January disbursement of Mr. Jones?
$1,571,383.22.
So moved.
And second, and all in favor for the approval?
Aye.
Okay.
Aye.
All right. So 2020, just a couple things. 2020 was a really odd year for everybody and it's behind us. We have a lot of things to look towards for 2021. We have, as we heard yesterday in the chairman's meeting, the mental health situation is going to get worse here. We really don't know what's going to happen with COVID at this point in time, so it's very important. I hear from people, a lot of different people, how important that this district has been during this time. So this has been a great group. I thank you again for nominating me as chairman and all that. But this has been a really effective group, and I just want to thank everybody for all the work that you do, for everything that you do. So, and look forward to a great year ahead. Yeah, lots of work to do, and we're in a good financial position to do it. Jennifer, do you have a report for us?
I do. Let's see here. So essentially, we have got a lot of things that we were working on completed at the end of last year. We completed the deliverables with the county for the right of way, as well as the dedication of the road. And I'm still just working now with council for the hospital and the VNA with regard to the existing easement agreement that we entered into in 2018 with the hospital. And so we're working through the last bits of that. Actually, that became a little bit more complicated than I anticipated because there are a lot of parties to that agreement and parts and pieces. I'm also updating the council of Gray Robinson with regard to the changes with real estate that went on in 2020, that being the two items with the county, as well as the amended and restated hospice house lease, so that they have an accurate file, and they're going to take a look over with me on the easement agreement to make sure that everything is tracking in accordance with what we did in 18 and now what we've done to date. So working on that, and then also I'm still trying to track down, all of your bonds have been renewed. I'm confident of that. I have the renewal paperwork, which is important, but the original bonds were put in mail, and the mail is a nightmare right now. So I don't have them, and I'm trying to find them, and I will get them, or they'll be reissued because they do need to land in Tallahassee. So I've been working on.
And they said they mailed them.
I know,
It's not that
insurance
hard
company.
up there, is it? But, you know.
No,
now
they
I'm
came
trying to get
from,
something
they came in from
California.
Vero Beach, from
Right.
our insurance company to me, and I have not received them. I've confirmed that. So working on little things like that, and then we'll have a presentation for you all as well on our conflict of interest policy, conflicts in general, public elected official matters, as part of our kind of education series that we're trying to do. I think we were planning to do a lot more of that last year than we got to do because of what happened in end of February, beginning of March. So you'll see some more of that from me this year. And any other questions for me at this time? I sent y'all an email on the research I was supposed to do yesterday. Basically, you can't really do anything as far as a leave of absence as an elected official unless you have a military reason. We are at war with a foreign government, or and you volunteered in the National Guard. So just for common knowledge on that one.
You know, does that pertain to government officials that are being paid? Because we're not.
Employees are different, and that triggers things. You're an employee, you fall under like the FMLA, but you're not an employee.
I
That's
mean, we're one of the
distinction.
government officials. that
There's different
is not
distinctions
paid.
for state employees, public employees, but you're not an
I
employee.
mean, it just
So-
seems to me like when you're doing something like this and you're really volunteering your time and effort, even though you are elected,
Mhm.
you should be able to take a little time off for a hip replacement or something, whatever. Mm.
So in any
It's
event,
nothing to do.
that is what I've been working on.
Okay, we'll move into the financial statement review. Alan?
Okay, thank you, and congratulations on your reelection.
Congratulations on yours.
Yeah, how
Your
about
treasurer.
So you'll be comforted to know the district remains in solid financial condition. As pointed out in your packets, as of the end of December, we had deposits and investments in liquid short-term FDIC insured certificates of deposit totaling $15,191,000 and change. And we just approved expenses a little less than $1.6 million, so that sum quickly drops to 13.5 million. leave another 2.2 million over the balance of the fiscal year. So in sum, we should have about 15.7 million to spend on healthcare services and administrative expenses for the remaining 9 months of the fiscal year, and that works out to about $1.7 million per month. Our budget calls for about $1.1 million per month. So we're in sound shape, and if things go as planned, we should finish the year with reserves over $4 million again after October, November expenses are accounted for. In other words, we have flexibility to comfortably support unanticipated healthcare needs the public may experience. This month's expenses of 1.57 million are a little higher than normal and probably deserve some comment. It consisted of some unusual expenses that are not representative of a normal month, including payments to the Agency for Healthcare Administration, ACA, of over $300,000, $92,000 in fees to the county for property appraisal and tax collection services, $40,000 for our annual audit, and unusually high expenses related to Phoenix Rising and Tykes and Teens that will not continue at that rate. So as I said, in summary, we're in good, solid financial shape, and we will not continue to spend at the 1.6 million. So, yeah, that's the report. Thank you.
Good, thank you very much.
Okay, I think I covered everything in my written report to you. I'll add that the mental health scene, I am diligently working to try to get this crew together. It's a big group, and so as you can imagine, schedules are hard to come by. So we did receive the revisions from both Cleveland Clinic and Tykes and Teens for the intensive outpatient program that we are working on, and I'm getting the group together to review those again first part of February. And we did nail down February 2nd for our large delivery vision committee, and everyone is going to be in attendance for that. So we're offering those live for those who want to be here comfortably and in Zoom and on Zoom, so they can Zoom if they would prefer that.
Can we share those two proposals with the rest of the trustees and get their input? I think that would be very important to do that. So
Yeah, that would
we
be
can
great.
see.
So I'll send those out. I sent them to just to the review committee, and we've not discussed them, but it would be good for you guys to see and weigh in on those for anything that you.
This is a big deal in the community if we could get an intensive outpatient process here, and that's what the mental health providers,
And
all
who was
of
the
them,
review
said
committee?
this was the #1 thing that we're lacking here that they believe would really help.
And this is specifically for mental health,
Yes.
intensive.
There is a substance abuse component to that. They'll have, you have to license for either mental health or substance abuse. So one has to be your primary. So for those that have dual diagnosis and have some substance abuse issues along with their mental health issues, there is programming allowed for that within the treatment. The review committee for the group is Amy from the John Zahn Service League Foundation, Jeff Pickering from the Community Foundation, Mary Beth and myself, Vicki Soleil, and Sharon Packard from the school district.
Very good. Okay.
So we're beginning with, because we kind of focused it around beginning with an adolescent group of kids for that program, but they have both submitted to expand that to adults as it gets going. And they've all described it as a game changer. I mean, people are really hungry for that piece in the continuum of care that's been missing in our community for a long time. The hospital did it years ago with a partial hospitalization program. And it is expensive. It's an expensive undertaking, which is why we're including,
But
you
it's
know,
needed.
funders,
It's
but it's
needed.
needed. It's really needed. And so at any rate, we're gonna try to get that off the ground as soon as we can make the decision between the two. So I'll send those proposals out to you to look at. And, you know, as you can imagine, some part of that to this group for funding, I'm sure, for, you know, our population that we're serving that need those services.
But it was important that we included Johns Island and the
And
Community
the Community
Foundation in
Foundation,
that as
because
well,
they're-
to be able to step up.
Well, just the
And they
awareness
are
from-
looking to step up to
Mhm.
mental health in this community. They're really engaged in.
So it's going to be either under one or the other? Either
I
mental
would
health or
expect-
separate? Okay,
Oh, no, it'll be mental health. It'll be for
Mental health.
mental health, and then
Okay.
there will be a
a
substance
substance
abuse
abuse
component.
component.
Right, to the programming.
Excellent, excellent.
It's intensive, it's outpatient, but
Good.
it's intensive
Okay.
programming. So that will come your way. I was thinking about something else. What else can I add? Lost it.
Welcome to my world.
Welcome, welcome to all of
Yeah, no,
our.
I am right in there.
Just go through the alphabet and we'll come to you.
That's right.
I can attest, it does not get better.
I have been told.
All right. Thank you, and we
Yeah.
appreciate it. We're fortunate here, we've got Dr. Rosenkrantz and Ralph Turner with us today. We asked them to come and just give us another, everybody's talking about COVID vaccine, so we thought we would give the hospital an opportunity to kind of tell us where they are with that too. So I don't know, Dr. Rosenkrantz, are you speaking or is Ralph?
I will lead off and then Dr. Turner can add some commentary. So thank you, Madam Chairwoman. Just a couple items. I'll go through our COVID, where we are in our current state, and then I'll finish up with the vaccine information. So as of today, we had a total of 44 inpatients with COVID. 8 were in the intensive care unit for a total of 44. That is a high number, and we're still in the middle of a second surge at this point. So that's important to note. Not year to date, but through the pandemic, the hospital has performed 33,600 COVID tests on residents of this county. In terms of vaccinations, vaccinations started on December 17th with our first shipments. To date, the total number of vaccinations given by the hospital is 7,224. Our caregivers with the first dose are 837, and the number of our caregivers that have completed the series is 394 thus far. The total number of others outside of caregivers. So the total number of others with the first dose in the community is 5,929. Currently, we are undergoing second vaccines and preparing for that second grouping to come through. There is a limited supply of vaccine for first doses at this point that we have to offer. There were around 700 patients in the first grouping that were not on our Epic system that we're manually calling for the second shots next week. And those patients all will be called and notified by the end of business tomorrow on Friday for their shots to be scheduled the following week. Other second dose shots will be scheduled through Epic and the MyChart system. And so the basis and moving forward, we have a limited number of first dose shots. Most of that supply looks like it will go to Publix or the pharmacies from our standpoint. We're going to focus on our caregivers, our patients in the second shots until such time as a supply is available to do additional first shots. We're currently giving the COVID vaccine at not only the hospital and we've set up a tent to do that. We had converted entirely our urgent care at Sebastian into a vaccination center, and it was vaccinating when available 120 individuals per day. And then we do a lesser number at Point West, around 30 vaccinations a day. So we have the capacity for all shots to give around 500 shots per day at Indian River Hospital. And so I'll turn it over to Dr. Turner. Ralph, if you have any additional comments or questions or insights.
Hello, everyone. Everything he said.
Well, okay. Does anybody have any questions for Dr. Rosencrantz? Any questions?
Yeah, I had a question that's sort of tangentially related to COVID. Can you update us on the foundation? Who's in charge of the foundation now and who's operating that?
Sure. Thank you, Alan. So, you know, with Liz Bruner's departure, Lisa Mann has joined us in the interim capacity, and Lisa was a senior philanthropy director in the Philanthropy Institute in Cleveland for the Cleveland Clinic. And she joined us on site January 18th here to lead the foundation here at Cleveland Clinic Indian River Hospital.
Okay, thanks.
I have a question for you. Apparently last night, Governor DeSantis said that we are not, I think he put it, vacation vaccines or something, and that if flying in and getting a vaccine and flying back is not something that he was supporting. Are you, and can you even control that?
Well, certainly we want to manage and care for our patients that are here in the state of Florida and locally. You know, we're not the vaccine police, but certainly when we look at our schedules and do random samplings and audits, we do, you know, if someone doesn't live in the state of Florida and have an address here, then that's something that we would not follow through with.
Somebody's raising her hand.
Michelle, I think that's Michelle. Did you have a question?
Well, just that an alert just came over from the Sun Sentinel and other papers that there's a new rule that they will not allow non-residents to get the vaccine a few minutes ago.
Amen.
Yeah. I think that's a good thing. And I don't know if that's non-residents of Florida or is that non-residents of other counties, because I know people are going all over.
Non-residents of Florida.
Vicki?
Yeah, Dr. Rosencrantz, not to put you on the spot, but I just want to verify what I think you said.
Sure.
You have about 5,900 individuals in the community that still need to get a number 2. So between that and your own patients in the hospital, with the limited vaccine available, you will not be giving out much in number 1 shots. Did I get that correctly going forward?
Based on our current vaccine supply and what we see is a lack of additional vaccine for first shots, that is correct. That is subject to change, Vicki, if we do get adequate amounts of supply.
Yeah, and I'm not trying to put you on the spot because we're certainly handling those logistics as well. And it is a lot harder than just giving out flu shots or doing testing logistically. But currently, the governor said if you are under 65 and have health conditions, only the hospitals can make those exceptions. Do you see that changing?
I do believe that as vaccine supply, you know, becomes more plentiful, that may change, but I would hesitate to speak for anyone else.
I'm curious.
I'm sorry, Alan.
I'm curious, you said that currently we have 44 inpatients being treated for COVID and 8 in the intensive care unit.
Of which
There
8 is.
44. I couldn't hear you,
Total.
Alan, but the number's 44.
Right, that's what I meant to say. So I'm curious how close that is to your capacity, particularly in the intensive care unit.
So we have further capacity to expand. It's not an issue with the number of beds or the intensive care unit beds. With additional numbers, and we're not there yet, the issue becomes staffing at this point as opposed to additional bed space or ventilators or anything of that nature. And so, again, we're not there yet, but there will come a point if it continues to rise unmitigated that we would have to pull back on some of our elective procedures and repurpose staffing.
Thanks.
I think it's fair to say, though, that there are COVID patients in the community that are being cared for. They're not hospital appropriate, but they are being cared for in the home by caregivers in the community.
Absolutely.
So are you seeing
Absolutely.
rise? 44 is what was your peak? Do you know?
So it is close to our peak with the first surge. I believe that, again, I don't have the numbers on the tip of my tongue, but in the range of 44 to 46 was the peak of the first surge.
Okay, that's a little scary.
Yeah, it is.
Barb, do you have a question?
She kept lighting up.
Barb?
No, I'm sorry. My office phone was ringing through and I wasn't quite sure how to get rid of it. I'm good. Sorry about that.
Any other questions for Dr. Rosenkrantz and Dr. Turner? Or we let them go deal with what they need to deal with?
Yeah, but I do have one more.
Okay.
Is there any plan for, or any capability to target communities of color that might be especially vulnerable to this disease based on data that has been reported?
I think that's really a Vicky question answer.
I'm going to turn to the FQHCs.
We actually have set up 2 events in Gifford. About 100 people were immunized yesterday, and we have plans to be out there on Saturday. And we have been out to Fellsmere once and again have another event scheduled for Monday. So we are trying to take care of those folks that are more vulnerable. Again, starting with those that are the oldest first.
Thank you.
Is that by appointment only, Vicki?
Yes, ma'am.
Okay.
We're working with Freddie Wolfork. He's done an awesome job in the Fellsmere area. I'm sorry, in the Gifford area. And in Fellsmere, Jesse and Chief Touchberry have done a good job of making sure everyone is aware.
You were also down in South County as well, right?
Yes, we were in South County today. Kind of blew the lid off of our staying under the radar on Tuesday. As soon as people saw the cars lined up, they realized that it wasn't just testing we were doing there. But again, we have such a limited amount that we're asking people to understand that we're trying to help our most vulnerable TCCH patients first, as is Marie and Dr. Perrone taking care of theirs.
Go ahead, Karen.
Question about, I was on the legislative delegation meeting today with Senator Mayfield and Representative Grawl. And the question came up about the appointment program that the state is working on. I'm afraid I cannot remember the name of it offhand.
Sharecare.
Thank you, Sharecare. Are you involved with any of that? How are you feeling about that? Is that something that is going to help with the appointments, or not so much help with the appointments, help with the frustration of individuals trying to get appointments?
We haven't heard a lot about Sharecare directly, but it is a software platform that's being used specifically for the health departments and not across all of them necessarily. those state-run places that had larger drive-throughs for testing initially were state-run, not county-run. And we expect that that's probably the platform that they're expecting to use for their vaccination pods in those larger areas. But we have not gotten a direct response. Everyone's spinning in their own circles trying to make the task at hand work.
Sure. Any other questions? All right, thank you, Dr. Rosencrantz and Dr. Turner. We really appreciate you guys coming and telling us where you're at.
Yep, thank you very much.
Thank you.
Thank you, and thank you for the excellent job you're doing.
The one concern that did come up yesterday, also was the fact that home healthcare workers have not been necessarily prioritized relative to the same.
So before I punch out, I will just add a quick note about that. We have been speaking with Miranda Hawker, and she is working on a plan. And I know Pat Nipper has sort of been part of those conversations as well. So she's working on a plan, and we're here to support any way we can.
Thank you.
Great, we really appreciate that. Thank
Yes.
you, Ralph.
Thank you, Dr.
Good to see everyone. Take care.
Thank
Bye.
you.
All right.
All right, thank
Take
you.
care.
Mary Beth, this morning at Together for Health, if I may add, Julianne Price announced that there would be a home health care worker caregiver clinic on Tuesday. It's a 1-hour clinic with 75 vaccines available.
Yes, we have Robbie sitting right here, and he's
And 400 caregivers.
yeah. 75 is a short number, but that's good. It's the beginning.
We're
anyhow.
making, we're making a little progress, and I guess with the limited supplies, that's, the progress that we're making. But good to know that the Cleveland Clinic and the Department of Health are also talking to.
Yes. Okay, thank you. We will move into our funded agency reports, and we have Diana Grossi from Hope for Families with us. Diana? I know you're there. You're on mute.
I had to unmute myself. Thank you. Thank you for having me. You have, I assume you all have had my report. And, you can kind of go through it when you look at how many families we have served. I would like to speak really to the whole COVID issue. When on March 24th, COVID came around, I guess, around the beginning of March. I don't even know. You look back, how long ago was it? Give me 1 second, just 1 second. I'm so sorry. I happened to be home and my pool guy came and my dog is sitting on my bed. So when she wants to bark, I had to kind of stop her. On March 24th, March 25th, we put together a plan with the help of Cleveland Clinic, Treasure Coast Community Health, and Mayo Clinic in Rochester. And we were proactive, and we closed down one of our wings and decided that we would move all the families into what we call the T wing. It was the original wing of the building. And we would not be taking in new clients until we could figure it out. Well, we continue to have that wing for isolation. There it goes, I'm so sorry. Let me close my door.
Hi, everybody.
Sounds like my husband.
It always happens when you don't want it to happen. So there it is. So we closed down the one wing and we kept the other wing open. And thanks to CARES Act money, United Way, we did a couple of other things. We were able to get Remy Halo filtration systems into all of our air conditioning units. And we also got electrostatic fogger to fog all of our rooms. So I am proud to say we have been able to stay clean, except we did have one case of a family. She was working at a job for 8 years, and of course she got COVID. No, the only symptoms were smell and taste. We put her into isolation with her children, poor things, for 14 days. And we have not had a single case since. My concern, of course, is being able to keep that house clean. That's the way I look at it. And our staff, we did not reduce the number of staff. We have stayed open. We opened back up in May. We started taking in new clients again in May. And if you look at the data, we were a little bit below numbers, but we are not significantly below numbers. Yes, we get about 37 to 40 calls a month. And it's interesting because we talk about mental health. We have been gathering data on all of our intakes and who comes in and why do they come in and why don't they fit our mission. And actually, the biggest number that we have discovered is that their inability to work is the biggest reason why they wouldn't come into our shelter. The next biggest reason is background. They may have a violent violent background that we would not bring them in for. Mental health is literally fourth on the list because out of area, if they were from a hot spot, we would not be taking them in. So mental health is an issue, but there are other issues that are even more compounding. So that is really kind of my biggest concern and our biggest concern. But with it all, with our goals were, of course, to get families get primary care physicians. And with the data, you will see that about 40% of them come in, that's our entire number. So 40% come in with primary care physicians. Those are mainly children because they have to have immunizations and so on. When they left, we're at 87%. All of any new family coming in has got to get a COVID test, and we rely on Treasure Coast Community Health and Whole Family Health to do that for us. If they need the transportation, we transport them. We do isolate them. Well, we put them in restriction. Isolation is one whole different thing. Their food is brought to them and so on. If they're restricted, then they can come out at they can come out, but they can't really be with the general population. But so we get them tested, and like I said, since March, we have had one case, and it's because we take real precautions with what we do. And we could never do it without the help of all of our friends out there, all our health and mental health friends out there. The data is there for you. I don't know, you can ask me any questions. The transportation, we transport anybody who needs to go and wherever they need to go. But the first thing we look at is, who is your doctor? If you don't have one, we're going to make sure you get one. So that's kind of all of it in a nutshell.
Where are you getting them from?
I'm sorry?
Where are you getting the doctors from?
Oh, we send them to Treasure Coast Community Health and Whole Family Health. I don't know. Vicki, where do you get the doctors from?
Okay, I think it's important. I mean, you're not just going out in the community, you're sending them to the two ages, which is great.
No, we send them to one of two places. And we rely on our community partners, and Treasure Coast Community Health and Hope Family Health are our partners. And that's where we start. Now, you'll notice, well, some of the data right now, I pulled the numbers. As of today, we have 11 rooms available, and we will take in 3 more families that we will hope to move into that other wing. So at most, we will take 13 to 14 rooms out of the 21 right now. So with that, we currently have 10 rooms full, and 12 of those, we have 28 people, but you have to understand, we also have 3 pregnancies. The pregnancies, we have between 2 and 3 pregnant families that come in with pregnancies. So our first cue is to get that woman into some sort of health system immediately if they're not in one.
And Diana, on average, I mean, people come in with, I understand the pregnancies too, but 1 child, 2 children?
Well, if you look at our numbers, we're about 62% of our population is children. So it varies. It varies. We had a family. We had a 29-year-old come in with 8 children.
8 children?
Wow.
8 children. And then we have a pregnant woman who's 7 months pregnant with no other children. So it's hard for me to say what's the average. Probably the average is about 2 children.
Yeah. And can you just refresh us just what your timeline is, how long they stay there, and what your requirements are?
Sure. In order to get into the shelter, you have to pass a background check. Now, we review that, and it depends. I can't give you it's not like black and white. We take a look at their background, how old it is, and so on. They have to pass a drug test. Now, if they're on marijuana, okay, so they're on something for medical marijuana, we do not allow them to smoke that. They have got to get a prescription for liquid. So, and they have to have a prescription. And that's become an issue that we never had to deal with before. So that's a new issue. They have to be able to work. So that is one of our biggest numbers, is people not wanting to come, people that want to come into a shelter that can't work. They're on SSI or something or other. Then we send them back to Treasure Coast Homeless Services Council. So with that, and they have to be able to follow our rules, and that is the requirement when they come in. When they come in, they have to go through financial literacy training modules. They have to develop a budget, and they save 75% of their net income. After they have 2 months rent saved, we work with our Rapid Rehousing case manager and Treasure Coast Homeless Services Council to get those people into permanent housing. Our turnaround, our average turnaround is really now less than 89 days. Last year it was 89 days. Right now we're looking at about 83. So we can turn it around and get them into permanent housing. We now follow them for 1 year to make sure they're stable.
That's awesome. Any other questions for Diana?
No, but thank you for what you're doing, and thank you for the explanation. That was good.
Thank you.
Thank you.
Thank you for having me, and thank you for helping us. Our client navigator, we have been able to get people into medical, mental, and behavioral health faster than we have ever been able to do that before. So I need to thank you very much.
That's what we're here for. Thank you, appreciate it. Okay, we have WeCare. Dr. Saber is here with us.
Okay, so
And
we have a 90-second video.
You want to do that first?
If you don't mind, I'd like to do that first. Kate says she's got it. This is not so much for you, but for show to get clients.
Hold on, buffering. I can't control the internet, unfortunately.
In the meantime, you want to introduce Robbie?
Yes.
Maybe show everybody knows.
Robbie Robinson is our new executive director of the foundation, as well as the County Medical Society, taking Shelley's place for her well-deserved retirement.
Right.
It'll just go.
Yeah.
What's the matter?
Did you actually download the file
Yeah,
or
I
did you play
did.
it from the internet?
Try again.
The file's downloaded, it should just play.
That's what I did.
Yeah, that shouldn't be internet fun.
That's the first technology glitch of the whole week.
That's pretty good.
Well, Kate, do you want me to do the report first?
Let's try one more time.
Oh, I gotta do this.
I'm not sure what the problem is.
I gotta do it.
Can you hit download? Yeah, take your glasses.
So, I mean, this is the file.
You have to download, you have to go there and then you can download the file here. You try and just click that link and find it through the internet.
Okay.
It may be difficult.
I don't see
Might
it.
have done one of the other ones.
Download though.
Okay, all right, well, then we can't do it, we can't do it.
Well, and I can forward it to them as well. Sorry about that.
Okay, well, if you could take us to the PowerPoint.
Yeah.
You know, I want you guys to know that I really feel handicapped being a speaker with slides and no laser camera.
So I actually do have like the middle button.
Oh,
Okay.
hey,
There you go.
hey, okay. So this is just some small information that I think most of you are very well familiar with. WeCare Clinic is a referral clinic to obtain medical specialty care for non-insured indigent residents via volunteer medical professionals for free. That's what we do. We're sponsored by the Medical Association. We have one paid person amongst many, about 130 volunteers. That anchoring physician, Dr. Herman Fountain, is funded by you all, the tax district. He evaluates patients referred from primary care and community sources and arranges both indicated additional testing, and then attempts to find volunteer specialty physicians to accept the referral. He provides follow-up visits to be sure the problem is resolved. Many times the patient needs not just their original referral, but needs additional referral. And most of our volunteers provide services in their office. We have a few who actually come to the WeCare Clinic, not many. The clinic is considered to be a facility of the state of Florida Department of Health. And that way we get the sovereign immunity liability protection for volunteers who are contracted. The participation of the Cleveland Clinic Indian River Hospital through its financial assistance program that you all, of course, do, is an essential blessing in carrying out our work. We simply would be out of the picture without it. The foundation, the WeCare Foundation, is a 501c3 charity that raises funds to operate the clinic, so all the operating expenses of the clinic, and also provide a variety of direct patient support, such as prescription drugs, programs, medical supplies, devices, transportations, and special needs. These kind of wraparound services augment the efforts of our volunteers, and this kind of additional patient benefit is not available through any other medical providers in our county. These are our stats. This is year to year comparing 19 to 20. And so, let's see. This is good.
Should be the middle button.
So
There.
so it works on the wall, but not
Not
on the
me.
screen. Okay, well, some of you. So you see that October of 2019, there were 145 clinic visits. In last year, we counted the gastroenterology once a month clinic visits into our on-site, and this area decided that didn't make sense. They should be out of there. So that even though we took them out in October 2020, we had 163 compared to 145, but actually 135. In November, we had 102 compared to 92 a year ago, and December 106 compared to 75 a year ago. And I've highlighted there that these are just the visits that you're paying. These are Dr. Fountain's visits. These do not include a little bit of primary care that Dr. Baker and I do. And these do not include any of the volunteer specialists, just Dr. Fountain's work. And we also had a little bit of handicap because we had 2 nurses. Again, you guys fund, but we only had one of them present for 2 months. Someone had resigned for a better opportunity, and we were down 1 nurse for 2 months. And despite that, the numbers are all higher. This is just a visual picture for those of you who like bar graphs of color. Want to put that up, but it just shows the same thing as the last. In terms of new referrals, the patients that are seen by Dr. Fountain as new referrals, there were 51 in October, 21 in November, 38 in December, totaling 110. And of that 110, most of them have appointments, some of them are in process, but there were 174 new consults. So this is telling you that one patient does not equal one consult. One patient frequently has a number of consults, and that number 174 is actually a minimum. I've just spent a lot of hours redoing our statistical reporting stuff, and so some of this stuff I had to kind of didn't have all the information, but that is a minimum. Since other just little pieces, you guys had asked for some metrics, I'm trying to give you what's good. During the quarter, 91 referrals were completed and closed. There were at least 305 specialty visits from 27 different disciplines that took place outside of the clinic. And that does not include pathology and anesthesia, because that just up till now, that's not been reflected properly. I need to change that. But so that again is a minimum, and the value of donated services was $158,593, rounded up, just rounded up. Didn't have the pennies. Of our referrals they're primarily from Treasure Coast Community Health, 321, 21 from whole family, and 39 from other sources. And then we did expand our services a little bit. We have an acupuncture physician who volunteered with us. He started in this quarter and has already had eight volunteer visits for acupuncture for our patients. This is an update on our wait list, what's in the queue, comparing 2020 to where we are in this year, 2021 January, to the report we gave you a year ago. We still do have a wait list. Most specialties, the wait list is diminished, and in green at the bottom, you can see that we had 328 pending a year ago. As of right now, as of 2 days ago, we had 212.
And the reason for, some of them are decreased more than others. More of a partnership with Cleveland, is that what the?
No, the partnership with Cleveland is not any different now than it was a year ago.
Oh,
It has to do with 55 different things that go into finding a home for each patient. So it's not just one thing, it's like a million things. But the bottom line is that we've done better. We've been able to get more people in, or Dr. Fountain's been able to get more people in, and our list is small.
Can you just cover for them, because this has come up before, so some of those, clearly the 44 big number in ophthalmology is because we don't have very many.
No, it's all
So-
different things.
So, but right, so
No, so Anne Marie, that's not exactly the case.
okay,
So we do have volunteer ophthalmologists, and we have a lot of ophthalmology volunteer services going on, but we had a much higher need compared to our supply. So we had something like, I don't have this right in front of me, but something like 60 ophthalmology visits happened in the quarter, but we nonetheless still had 44 waiting.
to see the ophthalmologist.
To see
or
the
to get to it.
And we used to have an ophthalmologist who volunteered his time, but that no longer is.
So correct. We have had two retired ophthalmologists
Right.
over the years.
Right.
And our last one became disabled and unable to continue doing that about 2 years ago.
Right.
And we still have a room at Treasure Coast that we're paying rent on. that we
Just
would-
in case.
That we would like to find that doctor still. So we're still recruiting.
Okay.
Doctor, while you're talking about this, out of those 45 or so ophthalmology patients, and I'm sure it's true of others, how many of those are really serious, like needing eye surgery as
Well,
opposed to diagnosis or something?
So people who have something which is an imminent threat, we go all out. Dr. Fountain's on the horn talking to the people. So we had 2 cases in which I got on the phone to a retinal surgeon during this quarter to get people retinal surgery before they went blind. So people who are on waiting lists are on the waiting list for things that need attention, but they're not dying from it. Oncology, those waiting lists for people who have newly diagnosed cancer and needing treatment, those are very short. But for somebody who's got anemia, they've had it for 6 months, that may take a while.
Yeah. Well, Dr. Fountain came here a couple of years ago, and at that time, that list was over 500 people on the waiting list. So as big as those numbers seem to be, it looks like it's a lot better than it
That's
had
true.
to.
That's
Is that a
absolutely
fair
true.
comment? Yeah.
Yes, sir. That is a very fair comment.
So out of all of those, just one more question, out of those, which ones do you know that Cleveland does not have? I mean, I know they don't have ophthalmology, okay?
They do.
I don't know.
They do not have,
Podiatry? Dermatology.
no, they do have dermatology. They do not have ophthalmology and podiatry.
Okay. Those would be the only 2?
Yes.
Okay.
This is financial stuff. So last year, our receipts from the district were 75,115. This year, they were 77,383 and some change I can't see. We had some, our expenses were actually less because we had 2 months without a nurse. And so my footnote at the bottom in red, sorry, I can't do the pointer, but we actually have $13,833 that we received from the district to pay salaries that we didn't end up paying because of our staffing issues. And if the district wants that money back, we are prepared to give it back. We have great uses for it. We would just assume do some other things with it, but we have never asked you, our grant for you was, please pay these salaries. And so in all honesty, there is a little money in the pot where we didn't have the person to pay. So at some point, you can tell me what you want to do.
You have to tell us what you would like to do with the money.
Right.
And we will decide if we would like to let you have it, and I'm sure it would be positive, but let us know where you'd like it to go. I'm sure there's a great need. Did I overspeak? I'm sorry.
We spoke to you, and we're probably all right along.
The answer is the same. Bring us a proposal of what you're
Right.
gonna spend it on and secure a deposit, but we need that kind of
input.
But thank you for the transparency of that.
Yes, yes.
We did not do a new customer satisfaction survey because things were crazy with COVID. And we were closed for 2 months and, you know, we're glad it's 2021. Just a little bit of information. We are still have a hepatitis C program. We have a pretty smooth deal with the Imaging Drug application for the medicine to treat either 8 or 12 weeks for hepatitis C patients, which cures them about 95% of the time. So we're up to 35 cures, and that is 2.6 million of drug that we've gotten for those folks.
That's great. That's a big deal.
The staffing issues I already mentioned to you. We did reconstitute something that had fallen off in the last couple of years. The Medical Society has a V-Care committee that is composed of the staff, the physician volunteers from the Medical Society, some referring agency staff, and we just meet for an hour or so and try and work out bugs in the system. It's informal, but it's very important operationally. And so we finally got that going again in January. In years past, we had met every 2 months. And the group said, no, we got too much on the plate. We need to meet a month. So we've got another Zoom schedule coming out in February. The foundation, like probably most charities in this county, is perplexed as to how we're going to do fundraising when we can't have events. So our foundation is expecting that our ability to raise community funds that support paying the trash removal and the shredding and the electricity and that stuff we're going to have a lot of difficulty in getting the kind of community donations that we did in years past. In 2022, though, we're going to have one great Mardi Gras, so be ready. And also, just you all spent a lot of time talking about vaccines. We volunteered to have a clinic try and give out a small number of vaccines, and where we focus is just a hole in the map. So the hospital is doing physicians, and no one volunteered to do dentists and orthodontists. So I asked the health department for some vaccine to immunize dentists and orthodontists. And Robbie has spent only 58 hours on the phone talking to people and fielding calls and making schedules, changing schedules. But we did provide 181 doses for the first 10 days. We are currently out of doses. We don't know if we're going to get any more doses or not. And then Dr. Fountain and I also participated in the fairgrounds mass vaccination clinics for 2 weeks. So that you will probably see in the next quarter that Dr. Fountain's January numbers will be smaller than the year before, and the reason is because he was at the fairgrounds doing that instead of being at home. So not reflected on these reports, but next quarter. So in summary, month to month, year over year, all 3 months had higher visits than last year, despite the fact that we were down one nurse, which was crippling. And our waiting lists are continuing to decrease year over year. We continue to leverage the financial support that we're grateful from you, from the district board, to leverage that to obtain office visits and procedures, a minimum of 158,593 that quarter, as well as direct patient financial support items, imaging drug program medications. So your return on investment here is a minimum of 250%. That's not including the 2.6 million of IDP. That's such a big number of makers crazy. So they didn't do that. Vital partnerships with Cleveland Clinic, Indian River Hospital, Whole Family Health Centers, the health department, and others continue to be critical to help us do what we want to do, which is achieving seamless, high-quality free healthcare for our neighbors. And I'm happy to take this. Robbie, did you want to have something?
I just wanted to add 4 quick things, because I know time is limited. Number one, Dr. Saber is too modest to say that for 30 years we care for providing services. We're celebrating our 30th anniversary this year. Over that period of time, we've saved the county $17 million and 12 cents. Secondly, our collaboration with TCCH and the whole family is one that we really cherish. Tomorrow, we're meeting with Sheriff Flowers for our second meeting to set up a program for people as they leave the prison to get connected to healthcare. So we're really pleased with that. Thirdly, we're getting wrap cards out with information about We Care to every Goodwill, every dollar store in the county. We have enough for them in Spanish, and we'll have them in Haitian Creole soon. We go into a place like a dollar store and say, could you share this information with your customers? And then the manager comes out and says, well, I have no health insurance either. So there's a big need out there, and we're trying to reach those folks. And in conclusion, you'll get a proposal for that $13,000 early next week.
Okay. Thank you.
I have a couple of questions. It's a question and a statement. I know one of the things I keep hearing from these guys is that when they get the monthly bills, they want to know what this patient has been seen with. But that's been a problem in the past. Are we going to be able to start seeing that? Because you know a lot more.
So the referral,
Obviously.
so if Treasure Coast refers someone for dermatology, you have a new patient, or, you know, mark that it's a new patient coming in, but not anything in what they're referred for. So if we have, you know, that you have 27 disciplines, and you know that you have a wait list for all of these, it would be helpful for us to know that those people are getting through, or we're able to help find somebody.
The name is not with it though, is that correct?
Yeah.
The
Well,
person's
they're
name is
not, but
not.
it says, here's the visit, they were a new
Yeah,
referral,
it's just
no
visits.
referral for what they
So
came to.
can you help me out a little bit? How will the district board do something different? with
It's
that
just
information?
helpful to quantify for your wait list, so we can help get those. I mean, perhaps we can help, as we've been talking around the We Care table, for how do we get these people through to a specialist? So faster. If Cleveland Clinic has all of those specialties, aside of those couple specialties that people are coming to you for, and you're struggling with getting them in, you have said, sometimes you don't know if they got in, if they got back, if they are through the system, if we know why they're coming to you, what specialty they're in need of.
And so,
I don't want to belabor it, I'm just saying we've
so
asked
if
several
you
times.
simply want to know where our largest queues are, I've given you that.
Okay.
So what I'm wondering is, if we give you, 54 new referrals this month, and the first reason for the referral for these 54 people was A, B, C, D, E, F, G, H, I.
Right, I know.
How does that help you?
Okay.
I'm not clear.
That is a question that's come up at this table. If you guys are not interested in that and need to know why they're coming and why they're not
So, I
getting
mean,
through the
it's
system.
kind of our job to find homes for these folks. I'm glad to tell you what the queue is, but I'm just, I mean, I
Okay.
don't mind giving you the information.
No, okay, I just.
But I'm just not sure how it's
before,
helpful.
you can't do it.
And what you do.
Well, I'll pick up on that a little bit. Where it would be to help us understand the seriousness of the issues that these patients are confronting. You're prioritizing it, and you've already answered my question on ophthalmology. You said if it's a really serious thing, you figure out a way to get them in there. But I think, and I'm not the one that asked Anne Marie for this information, but I'm just answering your question. I think it would help us getting more and more commitment to We Care and what you're doing if we understood the types of needs that these patients have that aren't being met. So we hear vague things like, a lot of people need knee replacements and it's not urgent, but they're gonna need it eventually. But if we had more information about that, I think it'd help us understand more. The more we understand, the more we committed, I think we can be to what you're doing. So I don't see why that's hard.
Well, it's not hard to provide, it's just a little more paperwork. But, you know, so my question was kind of
Well,
the difference in this.
okay, you know, I'm not quite sure how it appears. And I know I was asked a while back, I was chairing a committee on weed care, trying to get the Cleveland Clinic physicians on board with weed care. We were working with Dr. Mackett, et cetera, et cetera. This is while you were still in practice, of course, and, you know, and we haven't had any kind of I have no idea what the problem is or what you are looking at, but I am a nurse and maybe, and I know all about HIPAA, so I don't have to be told. So if there's any way that I can take a look at it and see what, and I agree with you, if we know that there's more ophthalmology that's coming in or more whatever, we have more feel of what the needs are in the community coming to weed care. So I know it's paperwork, Dr. Saber, but it does help in the long run.
So this is the kind of thing that I would be able to do. Okay, so it would say cardiology referral for chest pain.
Right.
Cardiology referral for congestive heart failure.
Right.
Ophthalmology referral for decreased vision. GI referral for abdominal pain.
Right.
Dermatology referral for skin bleeding.
Are we getting that now?
No.
No.
Okay.
But and I can provide that to you.
Yeah.
But I'll just be really honest with you.
It's a pain.
No, it's a small pain. I'm willing to do it. But I don't know how it's going to happen.
But it's a lot.
I just don't know how it's going to happen.
Well, at that level of dimension, probably wouldn't happen.
So what I can tell you is that, you know, we got 12 pending in dermatology.
Okay.
Right.
So we are getting it.
If you want to know
broken
if
down
5 of them are
for
rashes
discipline.
and 6 of them are bumps, I mean, I can tell you that, but I'm just
that
like
doesn't
sort
make
of
any
curious.
sense.
No, it
Yeah.
doesn't help
Are
us.
we getting it broken
We
down
don't
by
want to ask for
discipline?
more information to do nothing
All
with
of
it.
it
It's
is
not going to help. It's silly.
All right, it's not even broken down by
Let's take this
discipline.
on, let's take this offline.
Okay,
My other comment to you, and it's not just we care, but it's all of the providers, I think. And it comes back to the vaccine. The vaccine is free from the government. Okay, but you folks are out at fairgrounds spending your time, right, to give them. And certainly Vicky's people are spending a lot of time, and certainly the hospital is spending a lot of time. And that's not covered through anything, right? I mean, the government has not said, here's $75 for every person that you have. getting a
Unfunded
vaccine."
mandate.
It's an unfunded mandate. Is that not right?
Well, so I'm not the right person to answer that. I know that there has been some state funding because most of the big chunk of travel nurses working at the fairgrounds that have been hired with funds that the health department got from the state. Details of that are not part of my purview. I don't know.
Okay, well, I guess that's something that, you know, Vicky and Marie and the other folks need to tell us from their perspective too. Because it's a question, it's just a question that I have. I mean, is there any support for all the funding that people are spending?
It's not part of the package, that I can tell you. So our coalition Wall Street did not have any funds for organizing and administering vaccine. No.
Okay, I think that's important for us as a district to understand, for our providers that are spending time and effort and people to do this, that this year particularly, what they're gonna do. We just need to be aware.
Ask Vicky, are you getting any money, Vicky?
The feds are expecting that for the Medicare patients, we will submit a claim to Medicare for the administrative portion.
Okay, so for Medicare, you will.
Yeah, but that's it.
Well, I will be very honest in saying the amount that they give for the administration of a vaccine doesn't even begin to cover the cost of collecting the insurance information, posting it out to the insurance, working the claim, etc. So it is difficult.
And certainly none of the other Blue Cross or any of them, right, are saying, here's your line.
No, nobody's standing in line to give us money. As Karen said, it really amounts to an unfunded mandate for the providers. Marie, you want to jump in?
I concur, Vicki, exactly what you said is true. We are not getting anything to administer the vaccines. We're doing it for our patients in the community.
Are you able to quantify dollar amounts of what you're spending? Either of you?
I know my payroll was really large in June and paying time and money to do weekend vaccines. I can't quantify it right now, but give me a little bit of time and I will.
Yeah, the issue is that the phone calls come in or go out and they are not easy to quantify. That Sue is only answering phone calls related to COVID, whereas Mary is only answering calls related to regular services. And so it's really interwoven into our business dealings. But Marie's an expert at crunching numbers. So if anybody can do it, I know that she could, but she's absolutely right. You know, we don't have a National Guard that we can call. We are calling upon our current staff at overtime rates. And that's going to vary, you know, according to who's available on a Saturday or Sunday.
I just wanted to bring that up as an awareness for the vicar. So, thank you, Dr. Saber.
Thank you.
We appreciate it.
Thank you very much.
Thanks for what you're
Robbie,
doing.
nice
Thank you,
to
Dr. Saber.
meet you and good luck.
Yeah.
With what you're doing.
Yeah, thank you.
Any unfinished business from the trustees? What? I'm following the agenda right here. Okay, new business. We have Kip is back to talk about the 1920 audit review. Welcome back. Watch your hand.
Thank you. Yes,
Worries me.
for sure. It's close. It's a big table. Yes, thank you for having me back. And today, on phase 2, we're going to talk about your year-end financial statements. As you know, your year-end is September 30th. So this report covers the most recent fiscal year-end, September 30, 2020. I've been through this before, but I'll refresh your memory.
No, it's okay, we know that.
You already know
Yeah,
how
we
it's
do.
constructed. You know all that. Okay, all right, let's dive into it.
We're good.
Okay, the MD&A gives you the overview. I'm just going to highlight a few things. Page 3, table 1. It was a table added last year, and it gives you a presentation and position of the hospital district's taxing rate relative to all the other taxing entities. Your past year, you were at 0.8011. 5.3% of the total for the county, and that was down from the 91.22 in the prior year, which was 5.9% of the total. So you dropped down in rate and in your percentage proportion. The next page goes through some very basic and upper level type of issues that you experience. And of course, there's a focus on COVID-19. That was a big play, obviously, for everybody. So there's some discussion there, and continues on page 5 with your strategic plan and the fact that for fiscal year ended September 30, 2020, you raised your indigent care funding level from 150% of the poverty level to 200% of the poverty level. So there is that impact in terms of your disbursements for indigent care. I'm going to skip through the next couple pages because it's verbiage and I like the picture better. So we'll cover the same information. Page 7, table 3 gives you an overview of your financial position. Your total assets up to $7,051,925 from $6,774,000 in the prior year. Most all of that is in cash and investments, 5.6 million compared to 5.2 million. Your capital plant investment right at about $1.4 million. Your current liabilities of $1,164,000, down just a little bit from the $1,252,000, but pretty representative of what you run on a monthly basis. And so the difference remaining is your equity in the organization, referred to as net position, of $5,887,000 compared to $5,521,000. And most of that is in unrestricted available reserves of $4.5 million at the end of the year, about 430,000, 440,000 from the prior year. So very strong financial position, as you commented earlier in your updates for the current period.
Alan tells us that every month.
Yeah, you know, I hate to steal the thunder for Alan, but I'll just reiterate it. It's a good story and it's a good picture. Table 4 at the bottom shows the revenues and expenses for the year compared to the prior year. You can see that your ad valorem tax revenues were down just under $1 million from the prior year, and that's planned. The millage rate dropping as it did was a cause of that. And then your expenses, you actually increased your indigent care funding about $1 million from the prior year, right at $13.2 million. Again, that's going to be partly due to the raising of the poverty level. That's going to, of course, increase the cost. Some of that's COVID related, but most all of that was planned, as you'll see in a minute. Your administrative expenses are down quite a bit as you tailed away from the expenses that you incurred really in support of the Cleveland Clinic transition from the medical center. And then lastly, it's probably a smaller number on the page, but I think it's significant to note that with your plan to move your excess reserves out of cash and into investments, your investment income jumped to $73,000 from $16,000 in the prior year. So that certainly goes to pay for some programs. Page 8, table 5 gives you a breakdown of the various different agencies that you funded year compared to year. And again, it's the $13.2 million compared to $12.2. Of note, you actually budgeted $12,994,000 for the current year. So you really weren't that far over the budget as you reacted to some of the issues that the county was experiencing. And so you can see the variety of the things, the movement out of the medical center and fully into the Cleveland Clinic funding for the full year, the investment that you made into Treasure Coast Community Health away from the health department, but an expansion of that service and program as well. Down towards the bottom, we have them lumped together as other agencies, but there are about a half a dozen small fundings to agencies that you provided for the first time this year. So all of those added up to about $1 million increase in your program expenses compared to the prior year. Let's go to page 10. That gives you an overview of your budget in table 7. And again, you planned for a reduction in your ad valorem revenues. You were short of that by about $55,000, but that shortfall was made up by the investment return that you had. So your revenues came in very close to budget. Your expenses were also very close on a favorable basis of just under $300,000. So overall, you had a favorable variance from budget of $296,000 on the bottom line as you've increased your equity or net position. And then the last part of the MDA is the factors bearing on the future, and you've identified a number of items that you're focused on for the upcoming period. It gives the reader the financial statements and insight as to where you're heading. You left your ad valorem tax rate constant, but with the increase in valuations, you're looking at about a 5% increase in your revenues for the 2021 year. And it shows where you're making those investments, some of the issues that you're looking at. So those are all of the items that management wanted to focus on with respect to the year and the upcoming year. The next section gets into some more detailed information on the same data.
Can I ask one question? Does this include the reimbursement we got for peers? It does not.
No, that happened this year.
That's this year. Okay. Right.
Page 13, I just point out at the very top, the breakdown between cash and investments. You can see the movement of cash into investments that you made as you're trying to maximize the return on your reserves. And we'll a few pages. New footnote, if we go to page 19, there's really no new accounting policies to deal with, so that's why I flipped past that area. But footnote 2 at the bottom gives you a more detailed discussion of the investments that you're into. It's important disclosure because your stakeholders want to know that you're doing what you can to be safeguarded with respect to your investments. And these qualify under the Florida statutes in terms of the investments. And they're really near cash. Their weighted average maturity is right at 17 days. You have day by day ability to withdraw. And they're all stated at a net asset value of $1. So it's essentially really cash, but it certainly gives you an investment pool to draw some earnings from. Page 20, footnote 4, gives you an overview of the designations that you set aside at the end of the year. You've set aside for the first time just over $2.5 million for investment purposes, and you can see how you adjusted your other longstanding designations for a total designation of your reserves of $3,590,000. That does not include the more generic reserve for uncertainties of $1.5 million, which you carry as part of your budgetary process, because that's essentially reserves for uncertainties, reserves. The balance of the document is fairly standard and consistent. Maybe go to page 23. The subsequent event footnote, and it does indicate in that footnote what you budgeted for indigent care for this upcoming budgetary year of right at $13.2 million. And then the last part are the special reports that are required for governmental entities reporting to the Florida Auditor General's office. They're all clean, unmodified reports, no matters, no deficiencies of any significance to report. So a very clean, squeaky clean report.
That's good. Close to half. What we like to hear.
Thank you.
All right. Thank you very much.
Okay.
Yeah, I'd like to, you mentioned it in here, but just since it's a public meeting, I think it's important to highlight a little more the Gifford Health Center that was transitioned during that year that this report covers, because now it is a full service health center, and as before it was a somewhat limited pediatric center. So now that community has access and to full, almost full healthcare. And I think Treasure Coast Community Health should be complimented for the way they've been able to get accepted in that community as the new provider. And I think they ought to be particularly complimented that during the COVID, when they shut down a number of their offices, they kept Gifford open, even though it was new. And now they're providing vaccinations, which we talked about earlier, mentioned earlier in this meeting, and not only Gifford, but in Sebastian and Fellsmere. So that all happened because this district reallocated assets to make it happen. And we did it at the same time that the actual tax rate to the taxpayer went down. So I just, for what it's worth, I thought that should be emphasized. I think we should be really proud of that result, and very proud of the work that Treasure Coast Community Health is doing there.
Yes. Kudos, Vicki.
Kudos, Vicki.
Thank you. We're looking forward to putting a pharmacy in there. We had some construction delays because of COVID affected construction workers, but we're anticipating that'll happen in the next 60 days.
When is their next report?
Next month, I think.
Are we not? Yeah, I think we put them off.
February.
Yeah, we'll look forward forward to your next report, Vicki.
Okay.
Yeah,
We look forward to all of them.
yeah, but we haven't heard from Vicki in a while for all, you know, the full report.
Yeah.
Thank you for bringing that up though, Ellen, because I think that does,
Yes.
that was a pretty, really major change
Well,
in
it
the
was,
community.
it was traumatic to begin with, but the transition went beautifully.
Yes, it did. Yes, it did. Thank you, Kip. Thank you, Kip. We appreciate it.
Thank you.
Any other business from the trustees? Any public comment? Well, they're there. Anybody have anything? I don't want to leave anybody out. Okay, given no public comment, this meeting is adjourned. Thank you very much, and we will see you back in February. But this meeting will be at
Yes.
the.
Training myself to come.
Thank you,
I
everyone.
didn't know it was here.
Thank you.
Thanks, Ben.